Good morning and welcome to our channel today. Today we are going to be discussing a topic that I feel is very imperative for today's time. And I asked my little people what is a good topic to talk about today. So they said eating disorders and depression. So we're going to dive into the discussion about depression and anorexia nervosa. uh, ex- Examining their clinical presentations, comorbidities, and the therapeutic approaches uh, that that comes along with it. Now, this insight is aimed at both uh, healthcare professionals and individuals who are seeking a deeper understanding of these conditions. So this is where we can kind of dive into some of it for just a moment and see what is the interconnectedness between the two. All right. Now, depression clinically is known as major depressive disorder, MDD, a psychiatric condition characterized by a pervasive low loss of interest or pleasure in activities, and a range of cognitive and somatic symptoms. Depression significantly impairs the daily functions, or functioning, I should say, and is often combined or accompanied by feelings of worthlessness and recurrent thoughts of death or suicide. So, depression is a major thing, folks. It's a major thing. We really need to get a handle on why this happens and why we get into that mode of depression. It's all about figuring out the triggers, all right, and what triggers it, all right. Uh, so in anorexia nervosa is a severe eating disorder marked by a restricted intake of nutrition, leading to significantly low body weight, an intense fear of gaining weight, and a distorted body image. Okay, that's anorexia nervosa, just commonly known as anorexia. It is a complex interplay of the biological, psychological, and sociocultural factors, and is often comorbid with other psychiatric disorders, including depression. Including depression. So the interrelation of depression and anorexia. All right. How do these two intertwine with each other? The comorbidity of depression and anorexia nervosa is a subject of considerable clinical interest. We have studied this for quite some time. Why is it that when people are stressed, they tend not to eat, or when they choose not to eat because of some phobia or distorted view of themselves, they become depressed? Patients with anorexia often exhibit symptoms of depression, and vice versa. Okay. This bidirectional relationship, it should suggest shared etiological factors, which may include generic vulnerabilities, neurobiological abnormalities, and even environmental triggers. Even the environment can affect someone with these two disorders. Okay. Now, the clinical management of this and treatment approach of this comorbid assessing process, right? As a psychotherapist, I emphasize the importance of a multidisciplinary treatment. I feel that is pretty much the best route that could be taken. A multidisciplinary treatment approach for both conditions. For both conditions. Now, this typically involves a combination of psychotherapy, pharmacotherapy, and nutritional rehabilitation. Cognitive behavioral therapy, commonly known as CBT, is particularly effective, focusing on altering the dysfunctional thoughts, okay? The dysfunctional thoughts, because that's what happens, and the dysfunctional behaviors as well, okay? Encourage people who you see going through this type of comorbid disorder to seek out some professional help. That is something that I strongly advocate, is to seek out the professional help. Professional consultation in case of depression and anorexia can prove to be so beneficial, especially in the early stages of this. The early intervention is key to a successful outcome. All right. Now, listen, these conditions are not merely a phase or, in most words, a choice. It's a serious mental health disorder that requires clinical attention. Okay. It requires clinical attention. So, folks, I know today's video is just a little short, but I have to jump over on a session. Hopefully I can get all of this edited and uploaded for all the facets that use this. In summary today, the intricate relationship between depression and anorexia is crucial for effective treatment and recovery. Okay? You must first understand why you're going through what you're going through. Okay? Both disorders warrant careful clinical assessment and an individualized treatment plan. What I want you to do today is take a self-inventory. Do you fall under either one of these categories? All right? Are you ashamed of the way you look? Are you ashamed to get out of bed? Do you even feel like getting out of bed? Do you feel like carrying on through your day? Do you feel as if people are just staring at you for no particular reason? Do you look at yourself in shame? If you are under any one of those umbrellas, and it is affecting you physically, and people are telling you, hey, you need to eat, or something is going on with you, why you're so depressed, this is where you need to put yourself first. Prioritizing your mental health is the fundamental component to overall wellness. Okay. So thank you, folks. I do appreciate you listening in today. I do hope that you all have a wonderful, wonderful rest of the weekend. I know this is not a Tuesday, but at least I got one in. Thank you so much. Have a great day.